And I want to go through a consultation. When a woman comes in for a consultation with you, do they have to, do you consult with a psychologist, or do they have to see a psychologist, or do they just consult with you?
A lot of women, a lot of people, not just women, already see psychologists.
Yeah.
And it's almost an advantage to us if they are in therapy. You know, if it is a major psychiatric disorder, it doesn't make you a red flag that you shouldn't have cosmetic surgery. It almost makes it easier for us because you already are in therapy, and we can discuss it with your therapist whether we think you should continue with it or whether it is reasonable or isn't. So it does make it easier for a lot of our patients who already are in therapy. So it isn't necessarily a bad thing.
Okay, I want to talk about the actual process of having a surgery done. So take me through the process once someone comes in for a consultation.
So the first consultation, I always see them. They come and they tell me what they'd like to have changed or what they don't like. And then I discuss the options that they have to go through it. These are your options. Go and think about it. Come and see me again. Bring back your questions that you may have. Maybe discuss it. Maybe bring me some pictures that you like, that you don't like. Once that's set up, if I feel it necessary, I send them to my physician. Most of all, it's going to be my anaesthetist, who will look over them and decide whether they're fit for surgery or not. Once we proceed with theatre and the operation proceeds, we then like to see them soon after the procedure for a first follow-up, and then the follow-ups vary depending on the severity of the surgery. So those are generally the steps that we go through.
And if you do decide to go the route of plastic surgery, in your opinion, should people be getting a second consultation, or is one fine?
A lot of my patients will come to me after they've been somewhere else, and I'm sure half my patients will probably go somewhere else when they have a consultation with me. I don't think there's anything wrong with it. I do think as South African plastic surgeons, we're generally all quite good as a general rule. I believe that. We all follow very much the same principles. We all come from a very similar school of thought. So I don't think it's at all an absolute essential necessity that you do have a second opinion, but it is always nice to get a second opinion. You know, we all do things slightly differently, and maybe that's the difference that you're after. You know, it is an elective surgery. You can choose when and how and who to go to, so it's not an emergency. So by all means, get a second opinion.
And what are some of the side effects that come as a part of these surgeries that you don't usually hear about?
The bruising and the swelling. You know, it's very often the patients are, even if you tell them afterwards you are going to be bruised and swollen, they're always surprised. And again, it's this opinion of, oh, it's an elective cosmetic surgery. It's not going to be a massive invasive. It's not going to have a downtime. I'm not going to have any issues. But if you do an abdominoplasty, a full abdominoplasty, you can't walk around for a week without wanting to bend over or feel any pain. If you have a breast augmentation and I put it underneath the muscle, you can't drive for 2 weeks. You know, it's not a minor procedure. It is quite a big procedure to undergo.
So what would you say the time frame is to become fully recovered after a breast augmentation, say?
A breast augmentation, 6 weeks minimum, you know, before you can get back to gym.
Wow. So I guess it obviously differs in recovery time. And
it does. Everyone has a very different healing and a pain threshold. I have some patients who come for breast augmentation, 2 days later they're running around like...
Really?
I promise you, it's incredible. It also depends slightly on how you...
I'm sure they shouldn't be running around.
No, they shouldn't be running around, but they do. You know, they have kids and they go walking, they go hiking, and you've told them you cannot do any serious exercise for 2 weeks and you can't go to gym for 6 weeks.
Yeah.
And 2 days later they come for their follow-up and they say, I felt nothing, I've been to the beach, I played some beach bats. Like, there's just nothing you can do about it. But again, it's a very personal thing. It depends how they feel about it. And people's pain thresholds are very, very different.